Well, hello, everyone. Hope you are all doing well. It's now your turn to ask the questions you want answers to regarding COVID-19. Today, our guest analyst, health analyst, is Dr. Pa Patel Davlidabadi. She's the Associate Professor of Public Health at the University of Evansville. Dr. Pa will try to get to as many questions as possible now. First, Governor Holcomb's office reports vaccinations of children for measles and whooping cough, among others, are down 30 to 40% in Indiana. What should parents do?
Parents really need to get these vaccinations. I understand there are a lot of movements going on and there have been reductions in these types of vaccines, but it's also important to understand that measles, whooping cough, mumps, rubella, these are all diseases that can spread very rapidly amongst those who are not vaccinated. It's an Indiana issue, it's a national issue, it's actually an international issue as well. And so it's very important to get these vaccines. We need to have 90 to 95% back in order to have that herd immunity. So do not put off these vaccines. Definitely get these, as these can save lives.
Talking about our kids now, we're getting some reports that some children are testing positive. How did parents make a decision on whether or not to get their kids tested?
Right, so it's definitely important to look out for those basic symptoms. So cough or fever, chills, perhaps even a sore throat. If your child does have those symptoms, it's important not to rush to the ER. It's important to go to health appointment. And if you ask you if you need to go get a COVID test done for your child.
Well, some states are encouraging people to wear face masks out in public. New York has made that, well, close to mandatory, but other states are using the word encouraging. Is that defeating the purpose of wearing face masks for all?
Right, mandatory versus encouraging. Encouraging involves some type of personal responsibility to protect society. And so many states are encouraging. However, in some states, the local health departments are kind of superseding that and mandating face masks because local governments are allowed to supersede when it comes to public health guidelines. So it's definitely, even if it is encouraged, it's very, very important to wear that face mask just so you are protecting yourself and also others.
The so-called filtered face mask that I've seen popping up as ads on social media, some health experts say be careful because they only filter the air coming in but not out. What do you say?
Yes, there are a lot of those face masks out there, and it's true. They do filter most of the air coming in and not out. So they may be beneficial for those who are trying to protect themselves and avoiding COVID altogether. But if someone is diagnosed, they will not filter that air coming out. Most of these masks are not NIOSH approved either. So we just have to be kind of cautious about that.
Someone dear to my heart, my wife, has a good question. We hear about getting temperatures before you report to work or go to some places like restaurants and even hair salons. What happens if your normal temperature is lower than 98.6, say like in the upper 96 range?
Right. Not everyone's temperature is 98.6. It's not the standard, really. Body temperature ranges. It can range from a low of 96.8 to even a high of 99. And it's really dependent on age, physical fitness, gender, even the time of day you take it. And so typically the rule of thumb to keep here in mind is that a temperature of 100.4 degrees or higher indicates a fever, regardless of what your average body temperature is.
Well, some COVID patients have reported rashes and possible lesions. Would they be considered a symptom, or is this an after product after you've been tested?
Right. These rashes, lesions, minor spots are developing as a result of COVID. So typically most people are seeing this after they've been diagnosed. You commonly see this with a lot of respiratory infections. You even see it with the flu sometimes. So it's this body's natural reaction to fighting a virus.
Well, swimming pools in Evansville are closing for the remainder of the year. What's your reaction to that? Good idea or not?
Yeah, so that's actually a great idea. They're remaining closed. I believe they're following the Indiana State Department of Health guidelines as well as the CDC guidelines. And I know there are a lot of staffing issues as well. So it's definitely a great way to, again, prevent the spread and transmission of COVID.
Right, Dr. Pa Patel Davlidabadi, thank you so much, as always, for giving us your time and your expertise.